Let's get some more now on the news that the first Briton to be infected with the deadly Ebola virus has been named as William Pooley. The 29-year-old volunteer nurse was caught the disease while treating patients who had the condition in Sierra Leone. He was flown back to Britain last night and is being cared for at the Royal Free Hospital in London. And we can speak now to Dr Emma Thomson, who's a consultant in infectious diseases at the University of Glasgow and joins us now from our studio there. Thank you very much indeed for talking to us. Now, I know that you know some of the team who are treating Mr. Pooley. Just tell us a little bit about them and what sort of expertise they will be bringing to this.
Well, happily, Mr. Pooley is receiving almost certainly very, very excellent care at the Royal Free Hospital. I had the pleasure of training there, and I know that my colleagues are highly, highly trained specialists in the field.
Because this is going to be quite a challenging case, isn't it, given the need to try to ensure that the patient remains completely isolated?
Yes, however, this is not a challenge that has never been faced before in the UK. There have been several cases of viral hemorrhagic fever in the United Kingdom over the last few years. This is the first case of Ebola virus, but there have been several of other viral hemorrhagic fever viruses, including Lassa fever, and most recently a case of Congo-Crimean hemorrhagic fever. So the team are very used to working with these patients in a very high security facility with a tent which surrounds the patient, and they are able to deliver optimal medical care in this facility, specialised, highly specialised care, putting in specialised lines, and they may even be able to ventilate the patient in this facility.
Yes, you say it's very specialised care. We know that they don't at this stage have this experimental drug which may have helped some patients in the United States to recover. So what will they actually be doing to help Mr. Pooley to hopefully recover?
Well, as far as we know at the moment, supportive care is the mainstay of treatment for someone with a viral hemorrhagic fever like Ebola virus. The team will be assessing the patient's clotting. One of the problems that can happen with viral hemorrhagic fever is that the patient may develop bleeding disorders. The patient can be given blood products to treat that. One of the most critical problems actually in West Africa is that patients become very dehydrated, and simple rehydration with intravenous fluids can be life-saving. The experimental treatment ZMapp as yet is not of proven efficacy, although it's obviously a promising treatment, but we will need to see many, many more patients being treated with it before we know how effective it is.
We know that Mr. Pooley was not actually feeling too bad at the stage when he left Sierra Leone to come here. What do you think now is the prognosis and the likelihood of him making a good recovery?
Well, I mean, we can't get away from the fact that this is a very serious infection. It's one of the nastiest viruses out there. But we do know that with excellent medical care of the type that can be delivered in London in the Royal Free Hospital, that the patient has a very good chance of recovery, and I have absolute faith in the staff at the Royal Free Hospital, and I don't think he could be in a better place.
Okay, Emma Thomson, reassuring words. Many thanks for talking to us.
Thank you.